Hello and welcome, and thank you for joining us today. My name is Sarah Cott, Senior Vice President of Programming at The Hill, and I am delighted to welcome you all here to the 2023 Future of Healthcare Summit. I'd like to thank our sponsors, Novo Nordisk, Consumers for Quality Care, the Healthcare Distribution Alliance, and the PAN Foundation for their support of today's event. We're convening this morning at a pivotal time in healthcare. We're seeing exciting new opportunities for innovation. The Inflation Reduction Act is kicking in and aims to lower drug prices as Congress continues to think through additional pricing measures. In addition, the pandemic emergency protections have expired, leaving Americans wondering, what comes next? To help make sense of what's ahead in healthcare, we'll be joined by members of the administration and an exciting lineup of experts and advocates who will discuss advancing access, the pursuit of health equity, and resetting the care paradigm across the United States. But first, a few housekeeping notes. In addition to our audience here in the room, we are also live streaming this event on thehill.com. Please keep your phones on silent for the duration of the program, but we do encourage you to join the conversation on social media. You can follow us on Facebook, Twitter, and Instagram at The Hill Events, and we will be using the hashtag #TheHillHealth. It is now my pleasure to welcome our first guest this morning, Dr. Anthony Fauci, former director of the National Institutes of Allergy and Infectious Disease at the National Institutes of Health. Welcome.
Dr. Fauci, thanks for joining us.
Good to
today.
be with you.
You know, the last time we had you at an event, my colleague Steve Clemens was talking to you, and you were saying, I'm retiring for government service, but I'm not retiring. And I want to move on to the next chapter of my life. What is the next chapter of your life?
Well, some of it is unknown, but some of it in the broad sense is I felt at the end of my 54-year tenure at the NIH and 38 years as the director of the Institute, that what could I do to contribute to society in the next several years that I still have a lot of energy and a lot of passion about doing things. And I think one of the most important that I feel I'd like to do is to serve as an inspiration or a model for younger people who want to get involved in science and public service, or those who are already involved, to give them an idea of the kinds of things that can be accomplished. So it really is going to be something to be really serving as a resource through writing, through lecturing, through consulting, perhaps getting involved in an academic center, just more to focus on inspiring the next generation of scientists and public servants, because they really are the hope of our society. And I would thought at my stage, given having done this, having had the privilege and the experience of advising 7 presidents and being in the government service for over half a century, that I'd be particularly positioned to do that. So that's really what I was referring to as the next phase.
You've said, obviously, during the time of COVID was a very intense time, and the intensity hasn't stopped. And you're fine, as you've said, with intense moments, as long as it doesn't last for a long time.
Right.
This has lasted a long time. You've had death threats. Why do you stay in the public eye?
Well, because I mean, that's what I do. You know, I mean, it is me. That's part of my DNA. I've been a public servant all my professional life, and we are dealing really in difficult times. There's this tremendous amount of divisiveness in society these days, you know. And I always try to explain to people that differences and diversity of opinion, politically, ideologically, and otherwise, is in fact healthy for the country, because we're a broad country. We have differences of opinion, differences of backgrounds, differences in culture. So that type of diversity I embrace. What has happened over the last few years has been that diversity of opinion, ideologically and otherwise, has gotten to the point of profound divisiveness, where there is a degree of hostility, the likes of which is almost impenetrable when you're trying to get people together. And I worry about that, and I hope that there are a lot of people out there who also feel similarly to me that want to step up and do something about it. And by doing something about it, I don't mean to do it in a conflictual way, but to reach out to each other. I mean, the people who are angry and the people who are protesting, they're not all bad. They can't be all bad. There's something there that they have a problem with that hopefully we can meet each other halfway, and that's what I'm going to try and do.
As you know, there were protesters outside today. I mean, do you ever run into them? Do you ever engage them?
Well, I don't go out and decide I'm going to go.
No, maybe they decide.
But put it this way, they engage me.
Yes, yes. And have you had any positive interactions in that, or no?
Well, you know, it's an interesting question, and if I might diverge on it for just a second, because I often get asked, having done this for so many years, in the very, very early years of HIV/AIDS, 40 plus years ago, the activist community, mostly gay activists, were trying to get the attention of the federal authorities, the scientific authorities, and the regulatory authorities to get them to understand that the standard way we were doing things with the strict inclusion and exclusion criteria in clinical trials, the very stringent regulatory control over the release of drugs on a compassionate basis, was ill-suited to a disease in which virtually everyone was dying. It wasn't like another drug for hypertension where you have 7 other drugs and you're doing a clinical trial for an additional drug, so it takes 7 years to get it approved. They wanted to really relook at how you approach clinical trials and regulation. And they wanted to be part of the process. They wanted to have input. They wanted a seat at the table. And at first, the scientific and regulatory community were put aback by them because they were activists, and probably some stigmata because they were young gay men. I don't think we could deny that. And then what happened is that they began to be very provocative and iconoclastic and theatrical to get our attention. Once they got my attention, I was listening to what they were saying, and what they were saying was making perfect sense. In fact, I would be doing the same thing if I were in their shoes. And that's when I got together, apropos of your question, and really reached out and brought into the fold and gave them a seat at the table, the gay activists. And the effort for HIV from a scientific, clinical trial, and regulatory standpoint improved greatly by doing that. That's very different than what's going on right now. Because what's going on right now is not saying, let me get your attention, I want to explain to you what our side is. It's just attacking people in a very, very hostile way. There's a major difference between those two. One was trying to talk in a reasonable way about what can make things better, and the other is just trying to tear everything down. I mean, I don't see anything out there that's productive in my mind.
Well, speaking of the things that are out there, I wanted to, we're in 2023, we're heading into the 2024 presidential season, which has already really started. RFK Jr. has not ruled out, if he were president, to prosecute you. Ron DeSantis has used you in campaign ads using AI, so it appears that you are hugging Donald Trump.
Oh, that was wonderful. I really like that.
Are you worried about the country going into next year?
I worry about the country a lot because what we're seeing, and I think anybody who just takes a deep breath and looks at what's going on, that we are in an arena, an era of what I call the normalization of untruths. There are so many misrepresentations and distortions of reality and conspiracy theory that it almost becomes normalized. That, at a time when someone would say something completely outlandish or egregiously untrue and proven multiple times to be untrue, that person would be shamed, and then the society in general would sort of put that person aside. Now, it is so common for things to be said so easily that are totally and egregiously untrue. I mean, proven by facts and by data to be untrue. And when it happens so often, society kind of says, they throw their hands up and they say, well, that's just the new normal. we should not accept that as the new normal, because when facts are no longer accepted as facts, when distortions occur, and when reality is distorted, that will undermine the foundations of the social order and of our democracy. And history has shown us that. Turn the clock back to Europe in the mid-1930s, when that kind of propaganda against certain classes of people made people who were otherwise normally good people do horrible things. So I do worry about that. I think that there is a danger to our democracy if we accept glibly untruths.
Did Donald Trump play a role in that?
Well, you know, I don't want to be saying anything disparaging about any individual, but it is very clear that there was a distortion of truth when the president was the president from the first day. This is the largest crowd in the history of inauguration. It wasn't, you know, and the press secretary gets up and bangs the podium and says it was the best, the largest crowd. I mean, that was kind of a signal out there that, hey, it's okay to completely distort the truth.
The Biden administration, any day now, is expected to release a report on the origins of COVID. This was mandated by Congress. Different agencies think different things. Where do you think it came
I think
from?
we don't know. And I think we have to keep an open mind.
Will we ever know?
We might not ever know. We might not ever know. But certainly you want to keep an open mind and look at the data and the evidence. What's disturbing is that if you look at the tweetosphere, things are said as if they're facts when they're not.
Do you look at that a lot?
Well, I get it. My staff, my former staff used to put it in front of me.
Right.
But because someone says something that's not true and tweets it, and then somebody else tweets it, and somebody else tweets it, when you're on the fifth tweet, it isn't any further more true than it was on the first tweet. But it appears that the number of tweets makes it more true. Like, what?
No, that's okay. Now, looking at the future of healthcare, we had a massive healthcare challenge with COVID. The pandemic is now officially over. There's been a lot of Monday morning quarterbacking, as you know. You've said the government and you made some missteps. I talked to a lawmaker who was briefed by intelligence officials, and he said, we're going to go back to normal. This was in spring of 2020 in a few weeks. Okay, it took 3 years. So it was a very odd disease. But at the same time, how did we do? Because on one hand, it was a success. Getting the vaccine was unbelievable in unbelievable amount of time. At the same time, we've had so much polarization, the culture wars. What do we learn from that?
Well, there are a number of lessons. I tend to put it into two general buckets, the scientific bucket and the public health bucket. From the scientific standpoint, we did spectacularly well. I mean, the idea of going from a recognition of the sequence of a virus on January 9th or 10th, and 11 months later to have more than one vaccine that's 94 to 95% effective going into the arms of individuals is beyond unprecedented. I mean, if you had asked me, could that have been done when I was a resident or when I was in medical school, I would have laughed and told you, you're absolutely crazy, that'll never be done. And it was done. That was a resounding success. The lesson there is continue the sustained support in basic and clinical biomedical research that got us there. The other bucket is the public health bucket. And that's a complicated bucket because it has to do with real on-the-ground preparedness, communication, interrelationship, surveillance, sharing of information, and a country pulling together. So we thought we were really very well prepared. The world, not just blaming the United States at all, but the world thought that we were really very well prepared from a public health standpoint. And we weren't. This was a very formidable virus that kept on fooling us. The first time that we had a virus within the same outbreak to have multiple variants. The first time that we had a virus of respiratory nature that 50 to 60% of the transmission was from someone who had no symptoms at all, which fooled us about whether we should be wearing masks or not in the beginning, because we did not know that you could be sitting down next to someone who was perfectly well, and just by that person speaking, they would transmit it to you. All those things we didn't know. But the thing
But on the masks, I mean, that was also because we needed to keep the masks for healthcare professionals.
there were 2 or 3 reasons why we weren't recommending masks in the beginning. One, there was a shortage. We didn't want to take them away from the people who needed them, the healthcare providers.
Should you have been more upfront with the American public on that, though?
Yeah, we were pretty. I'm looking at Jerome. Yeah, we were very upfront. We actually said that's the reason why.
Okay.
I mean, we weren't fooling anybody. There wasn't any data to indicate that outside of the healthcare setting it actually worked, and we were completely unaware at the time of the fact that asymptomatic people readily spread it. And then as soon as we found out to the contrary, then we said, wait a minute, we really got to wear masks. But the interesting thing that I think was the most devastating negative impact was the profound divisiveness in our country. We were fighting a war with a virus. The virus was the common enemy, and we seemed to be spending more energy fighting with each other than we were fighting with the virus. That has to not ever happen again if we ever get a pandemic. We've got to pull together as a nation.
But if we have another pandemic, and Mitch McConnell, who, as you know, he suffered from polio, and one of the things he said that surprised him, and surprised me too, is that we all wanted a vaccine, or I thought most people wanted a vaccine, and then when we had a vaccine, McConnell said he was really surprised that a lot of people said, I don't want that. Did that surprise you?
Yeah, I mean, the whole anti-vax movement is not only surprising, it's very disturbing. If you look at the data, I mean, you're not asking anybody to love you or agree with everything you do, but just look at data. The curve of people who have either hospitalized or died of COVID, who are unvaccinated, the curve is like that. The curve of people who've been vaccinated, what is the curve of hospitalization and deaths? It's like that. It's profoundly different. It doesn't matter whether you're far left, far right, in the middle, those data don't change. Vaccines save lives, and vaccines do not kill you.
Last question, because we're running out of time. If you had a magic wand, you've obviously, as you mentioned, you've been a public servant for more than 50 years. If you had a magic wand for the healthcare system, what would you fix?
I would make it uniform so that there's equal access for the health care for everyone and anybody, for the individuals who are economically, remove the disparities among minorities. Why do brown and black people have social determinants of health so that when they get infected, they have a much greater likelihood of getting hospitalized or dying? That has got to be eliminated. That's what I would do.
Please thank Dr. Fauci. I really appreciate it. Hey, great job. Great job.